From West Virginia Public Broadcasting.
Support for the legislature today has been provided by the following. The High Technology Foundation, headquartered at the I-79 Technology Park in Fairmont. Online at wvhtf.org. Connecting West Virginia families and businesses through high-speed internet services. Learn more about connecting at frontier.com.
At the legislature today, motorists are buying less gasoline, and that's left the state road fund strapped for the cash to maintain and expand the state's road system. The Senate Transportation Committee today considered a bill to tax alternative fuels, just as other fuels are taxed. And we'll continue our look into the state's efforts to help children and families in poverty on the legislature today. And good evening, I'm Beth Voorhees. There's a legislative deadline coming up on Sunday. That's when bills must be out of Senate and House committees. Such a move allows legislation to be read on 3 separate days on the floors, as required by the state constitution. So committee chairs need to prioritize bills to be approved before the deadline. Dave Mistich takes a look at one of Governor Tomlin's bills introduced at the beginning of the session that's just now beginning the committee process.
While a law that makes driving under the influence of drugs illegal is already on the books, House Bill 2513 creates a definition of drugs in that section of code, as well as improves enforcement of those offenses. House Judiciary Chair Tim Miley explained a few provisions of that bill.
It allows a police officer to pull you over if they see evidence of what they suspect to be impaired driving. If they pull you over, they'll probably give you the field sobriety tests that are commonly associated with DUIs. They might give you the preliminary breath test, which might show no alcohol in your system. But if, based upon their observation and experience, if they still see some indication or evidence that you might be influenced by some substance, they can presume that it's a drug or more, and then take you to have a blood test.
Miley noted that a refusal to consent to a secondary test while under the suspicion of drug driving would result in a revocation of a driver's license. Currently under law, a license revocation can take place if a person is suspected of driving under the influence of alcohol and refuses the preliminary breath analysis or secondary chemical test. Miley also said that ensuring proper training for police officers to identify motorists driving under the influence of drugs needs to be considered. Police officers would also need to be trained on how to administer roadside tests for not just alcohol DUIs, but also for drug driving offenses.
The bill is likely going to require some additional training by the officers, specifically related to detection of someone being impaired by drugs that may be dissimilar to being impaired by alcohol. For example, does the horizontal gaze and the nystagmus test that police officers perform on people at roadside stops for DUI, will that have the same effect if you're impaired by drugs? So it's that kind of training and those kinds of things that will be taught during the training that will help police officers and other law enforcement, for that matter, to be better prepared and equipped to identify those people.
As far as setting a threshold for drug driving impairment, similar to 0.08 blood alcohol content for alcohol, Miley said that facet of the bill has complicated matters.
We've gone back and forth with that quite a bit over the past couple of weeks because it's difficult, number one, to identify the level of impairment for a single drug to be in your system. In other words, how much of a single drug in your blood will cause impairment or likely to cause impairment. It's even more difficult if you have a combination of drugs. You might have lesser of this drug, but when combined with this other drug, you might have a combined impaired effect.
The House Judiciary Committee met at 2 this afternoon, and among the bills discussed was the governor's drug driving bill. A 5th draft of the bill developed in a Monday subcommittee meeting was adopted and added a definition for controlled substances. Various other aspects of the bill were also modified, including the omission of urine tests as a secondary chemical test for drug driving. It will now be considered by the House Committee on Finance. For the legislature today, I'm Dave Mistich in the House of Delegates.
Governor Tomlin ordered the creation of a Blue Ribbon Commission on Highways last summer to study the funding of the state's highway system. That report is due in early May, but until then, It's still up to the Senate Committee on Transportation and Infrastructure to consider legislation relating to roads. Today, the committee debated 3 of those bills relating to alternative fuels. Ashton Mara reports.
The State Department of Highways doesn't have enough money to build and maintain the state's system of roads. Thanks to more fuel-efficient vehicles, consumers are buying less gas, meaning there are less tax dollars going into the state's road fund from the gasoline tax. And alternative fuels are tax-free, so the legislature is considering how to raise more money. Senate Bill 454 determines the tax rate for alternative fuels used in motor vehicles, like natural gas, but excludes electric. The bill would require the tax commissioner to determine the gallon equivalent of those fuels by January 1st of next year and set the fuel tax for alternative fuels equal to the tax paid at the pump. Senator Clark Barnes was concerned that setting the tax rate as equal would discourage consumers from purchasing the fuels. But Ryan White, counsel for IGS Energy, a commercial company who has committed to building several compressed natural gas fueling stations around the state, said his company doesn't believe the tax rate will increase the price of natural gas enough to offset the savings.
What percentage of increase will this bill create over the present prices that individuals are going to be paying, and will this bill create a disincentive for, say, your company to continue to put those facilities in?
We've looked at it and done the numbers based on the way we believe the tax department's saying they want to do it, and we don't believe there's going to be a disincentive because of the market price and because of the way it's calculated based on the market price.
White told the committee in order for the tax to cancel out the cost savings of using natural gas, the cost of 1,000 cubic feet of the fuel would have to increase by $12 or $13, something White says he can't see ever happening in the future. The bill was passed and advanced to the Committee on Finance. Senate Bill 354, a bill sponsored by Senator Robert Plymel of Wayne County, directs the Commissioner of Highways to conduct a study on alternative sources of revenue to fund the state highways. Maintenance and construction of state roads is funded through fuel taxes or federal money, not from the state's general revenue fund. Senator Bob Williams of Taylor County expressed some concerns with the legislation.
I'm a little confused, and perhaps the others on the committee can guide me, since I know some of the members of the committee do serve on the Blue Ribbon Commission. But how does this study that we're going to pay $250,000 for, up to $250,000, differ from what the Blue Ribbon Commission is doing and what the charge of the Blue Ribbon Commission is to study funding alternative revenue sources for the Department of Highways?
The governor established the Blue Ribbon Commission on Highways to study what it would cost the state to maintain the road system we have now and how to fund its expansion. Committee's counsel said she had questioned a member of the governor's staff about Senate Bill 354 and was told by the governor's office that this bill was unnecessary. But Plymel, who is a non-voting member of the Blue Ribbon Commission, disagreed. He says this study would focus on taxing based on the miles a vehicle travels on the road instead of the amount of fuel purchased, something he says the commission hasn't considered.
We don't have a vote in this in terms of we're just going to get what they hand us. And I'm not as enamored by the direction that they're going. And I think that if it ultimately is going to end up here with the legislature.
Of course.
And if we don't go ahead and look into these and come back with some recommendations, I don't think that the report is going to be as complete as we need, and it's not going to include items like this.
The fiscal note attached to the bill says the study would cost the state as much as $250,000, a price some committee members thought was too expensive.
I'd like to meet with the Department of Highways, see how they came up with this $250,000. Don't necessarily want them to come up now, but I'd like to meet with them privately, because I don't have the slightest idea how they could come up with that.
Council, would you like to share your conversation there in regards to?
Well, I think what the fiscal note, if you just review it, what it says is that's what they estimate the cost was, I think, for the Blue Ribbon Commission study, and so they're projecting the same sort of price tag for this study.
Okay. In other words, they don't like this bill.
Still, committee members wanted more explanation. Senator Clark Barnes of Randolph County thought taxing based on the miles driven rather than fuel purchased was taking away the incentive to purchase less fuel. Senator Bill Cole of Mercer County said he felt the tax was too similar to putting a user fee on the roads, something he says has been widely unpopular in his area. Plymouth tried to explain again.
The bottom line is our roads are in the worst shape that they've been in a long time. We're on a 24-year paving cycle when we should be at a 12.5-year. And we've got to find some ways to be able to come up with this.
I would use this $250,000 to pave a road.
The bill did narrowly pass 5-4, with Senators Plymouth, Beach, Kirkendall, Fitzsimmons, and McCabe voting for it. Senate Bill 493, a bill also sponsored by Senator Plymouth, set the standards for converting and retrofitting vehicles to be able to use natural gas as fuel. The bill would require the use of Environmental Protection Agency certified conversion kits and prohibits the modification of the original engine produced by the vehicle manufacturer. It was that language the committee needed clarification on, which came from Senator Cole, a car dealer outside of the legislature.
It basically says you can bolt on a kit. It talks about you cannot drill or tap the diesel engine manifold. You can't drill or tap the diesel engine intercooler. So it tells you that you can't create new holes. You can take a bolt-on kit.
So you can, in fact, retrofit the engine for dual fuel without modifying the original equipment.
That's the way I read it.
The committee unanimously passed the bill with the recommendation for its approval by the full Senate. For the legislature today, I'm Ashton Mara in the Senate.
In a moment, we'll continue our look at the state's response to assist children and families in poverty. First, here's a look at what's coming up in the Senate tomorrow. Among the bills up for passage in the Senate tomorrow, Senate Bill 80, requiring that the duties of a professional educator employed as a supervisor or central office administrator shall include substitute teaching on at least 3 instructional days each school year if they hold a valid teaching certificate. Senate Bill 384, requiring any attorney appointed to represent juveniles to complete 8 hours of continuing education every 2 years in topics specifically related to juvenile proceedings. And Senate Bill 429, to remove adult family care homes from the definition of a facility in state law and therefore coverage under the Medication Administration by Unlicensed Personnel Act. On its website, the West Virginia Healthy Kids and Families Coalition outlines its goals for the coming years to organize a broad coalition across race, religious, geographic, and ideological lines to research and develop a full policy agenda that, if implemented, would reduce child poverty in West Virginia by half, and to create and begin to act on a legislative strategy for achieving that goal. Joining us tonight is Stephen Smith, the Executive Director of the Coalition. Prior to coming to Healthy Kids, he was the Director of Organizing for the Illinois Coalition for Immigrant and Refugee Rights and is the author of Stoking the Fire of Democracy, Our Generation's Introduction to Grassroots Organizing. He's a graduate of Harvard University and the London School of Economics. Welcome. So glad you're here.
Thank you so much for having me.
I am unfamiliar with your coalition. Can you kind of tell me about it and its work?
Sure. The Healthy Kids and Families Coalition has been around for about 15 years and was founded for the purpose of advocating for the Children's Health Insurance Program, CHIP. Now, we've been, our work along with lots of other people have been fairly successful. West Virginia is a model state when it comes to providing health insurance to poor kids, which is something we should be proud of. What our organization said about a year ago was, when we look at those kids, those children now have health insurance, which is great, but in almost any other way over that 15 years, they've gotten worse instead of better. The rate of kids with parents who are addicted, who are incarcerated, the child poverty rate is worse than ever before. And so our coalition decided to take a little bit of a step back and say, well, what would it take to generate the political will necessary to fix the whole big problem? Take a look at child poverty, take a look at the whole kid and the whole community and the whole family.
You've held a series of community meetings. What did you learn?
It was exciting. We learned a lot. 48 community meetings across the state with all kinds of different people, and then an additional 200 or so with different stakeholders. And you know, one of the things that really stood out to me was there is a very powerful myth out there that the reason we have child poverty is because poor parents are bad. They do a bad job of this, they don't know this, they don't know that. And as a parent of a 1-year-old myself, a lot of the things that got hung on the, around the necks of poor parents, I'm making those same mistakes too. And one of the things that was clear in those community meetings is that as powerful as that myth is, it is a myth. The most creative, resourceful meetings we had were with parents themselves, parents who were poor, who were struggling, who on the day-to-day were trying to figure out what best to do for their kids. And so it was fun to get to watch that myth be broken down, and that at some level is the basic tenet of our campaign, is that we need to not just be an advocacy group or even a bunch of advocacy groups based in Charleston. We need to be a coalition of kids and families all across the state who are saying this is what we need for our families.
That's so good to hear, because in our discussions about excuse me, reconnecting McDowell and that project, in talking with Senator Unger and others who are involved in raising children out of poverty, we do hear too much. Well, there's substance abuse, there's jail, parents are in jail, parents are abusing drugs, grandparents are raising their kids. And I hated to insinuate that people of low-income means are not loving their children and doing what's best for them, trying to stimulate them, trying to read to them. So I'm glad to hear that was a myth. I'm glad to hear that.
Yeah, it's the exact opposite. I mean, if anything, poor parents are carrying more of the load than we've ever asked them to carry before. And this is one of the other interesting things that came up in the community meetings. People would say, well, I grew up poor, but it was different back then. Yes. It really was different back then, it turns out. So if you look at the child poverty rates, they're growing. But so what that means is that the real wages have actually gone down. And meanwhile, the costs, things like medical care, child care costs have gone up. And not only that, but the support institutions that families used to rely on, church participation rate down, union participation rate down by 200%. This is a statistic that sticks with me. My grandfather, who passed away a couple weeks ago, had 4 jobs in his 93 years of life. My son, who's 1-year-old, is expected to have 30 jobs by the time he finishes working. And so all of these institutions, your work, your family, your union, your church, used to be a place we could rely on, but because of the way the economy has changed, we're actually putting more of the burden than ever on those parents.
So what do we do? How do we help?
So this is the conundrum. So fixing child poverty is actually very simple, but it's hard to do. There aren't that many things you can do to fix child poverty. Either you can increase the amount of money that's going into a poor family's pockets so that they have the money to be able to provide utilities and rent and child care and enrichment to their kids. So that's one. Find ways to put money into those families' pockets. That's an earned income tax credit. That's creating better jobs, higher paying jobs. That's one. The other is you can reduce the costs so that that balance sheet ends up better in the end of the day, at the end of the month. So you've got something like Medicaid expansion that's on the table right now, which would dramatically reduce. The average adult spends, in the neighborhood of $3,000 to $5,000 a year on their health care. And without health insurance, that's such an enormous burden that medical bills are the highest, the main cause of bankruptcy among poor families. So if we can reduce that burden on those families, not only the stress and the not knowing if you're going to have health insurance or health care, but also giving them essentially that money back to invest in their kids, there is nothing the state can do to fix child poverty more right now than adopting Medicaid expansion.
Governor Tomlin has not expressed whether or not he will expand Medicaid, has he?
He has not, no.
No. And the legislature does not have a role in this. This is something just the governor can do to expand Medicaid?
That's right. The legislature does not have an official say, although we've encouraged, as part of our platform, legislators and senators to express their beliefs to the governor. I mean, this is going to be it's such a big decision that we want to line up everybody possible to say this is worth doing. So, the AFL-CIO, hospitals, the business community, the faith community. We saw Bishop Bransfield's letter the other day, and then especially the 120,000 human beings who are going to have health insurance if we do this. It's making sure he's hearing all of those voices and knows that he's going to have the support if and when he decides to take this on.
And I don't even know a deadline when he's going to announce it or not, if he's given himself a deadline on this.
We don't. Recently he said within the next several weeks. Some people are saying by the end of this month. The short answer is soon, and we encourage anyone who's listening to go to MedicaidExpansionWV.org and send your own message to the governor about why you think this is worth doing.
The Senate Select Committee on Children and Poverty is meeting and working. What do you expect your coalition's role will be in that committee's work?
Our goal is to do whatever it takes to help them out. You know, if the solutions to child poverty are simple, they are also very difficult to do, and they require a lot of political will to do it. And so just the mere existence of a select committee is exciting for us, and we feel like it's our job to hold them accountable to come up with big, bold solutions.
Political will to do what?
Well, I mean, so we talked about the state earned income tax credit. West Virginia is one state that does not have a comprehensive early childhood program. So we're actually, you know, at the beginning of this year, we were going in the wrong direction on child care. Child care is something that you invest $1 in, you get $7 back. That's what they all say. And the reason is not only because it helps that kid have better outcomes, but also, and this is sometimes gets lost, my wife and I, our son is in child care. It's an incredible cost. If you have 3 kids in child care, it can be $10,000, $12,000 a year. So by funding and increasing that benefit for child care, we are giving parents the freedom to work and to have other resources to be able to provide their kids with. So at the beginning of the year, we were saying we're going to cut that for 1,400 families. Thanks to the work of Margie Hale and Jim McKay and Jeanette Barker and a lot of other folks, and in small part our coalition, we've turned that around, and we're now saying we're at least not going to cut those families. Well, the next step is to say, well, can we expand this benefit, and can we, you know, bring the 3-year-olds into pre-K and make this a comprehensive thing when we know those little brains are being formed, and make them make that process as fruitful and give those parents as much encouragement to keep working as possible. So those are a couple of the concrete things, but there's a range of things that we're that we will be asking the Senate and the legislature and the governor to take on. And then part of it is just, we really do need to have the conversation, you know, and we're excited to do that. And you know, I commend the Select Committee tenfold for going out and hearing the stories. You know, there's sometimes it's easy for the legislature to rely on the people who are in the Capitol. Well, the people in the Capitol are like me. You know, fairly educated, you know, professional at this, make a decent living.
And taking those, Senator Unger did say that he wants to not meet in the marble hallways of the Capitol, but actually out in the senior citizens community and places where people are comfortable coming to see them. Stephen Smith of the West Virginia Healthy Kids and Families Coalition. Very interesting. Thank you very much, and good luck with your work.
Thank you so much. I appreciate it.
Thank you. And here's a look at what's coming up in the House tomorrow. Among the bills up for passage in the House tomorrow, House Bill 2395, continuing within the Bureau of Senior Services and In-Home Care Worker Registry to provide the public a list of in-home care workers along with their qualifications who voluntarily agree to be included and who have obtained a state or federal criminal background check. House Bill 2453, requiring that in the initial stages of a missing or abducted child investigation, the reporting law enforcement agency shall contact the West Virginia State Police Communications Center by phone. The Communications Center will then contact the Amber Alert Coordinator to determine if the Amber Alert criteria are satisfied. House Bill 2717, requiring deputy sheriffs be issued bulletproof vests. House Bill 2809 to authorize a responsible parent pilot project by the Division of Corrections, and House Bill 3013 to authorize the establishment of job creation work groups to obtain information available to assist the legislature's efforts to take effective action to increase and attract jobs in West Virginia. On second reading in the House tomorrow, House Bill 2108, making the offense of failure to wear safety belts a primary offense and prohibiting denial of insurance coverage for prohibited use of electronic communications devices while driving. And this has been the Legislature Today. Tomorrow, our guest will be Reverend Matthew Watts, President and CEO of the Hope Community Development Corporation of Charleston. This organization is a partner in the effort to reconnect McDowell, as well as works to revitalize areas of downtown Charleston. I'm Beth Voorhees. Thanks for joining us. Good night.
Support for the Legislature Today has been provided by the following. The High Technology Foundation, headquartered at the I-79 Technology Park in Fairmont. Online at wvhtf.org. Connecting West Virginia families and businesses through high-speed internet services. Learn more about connecting at frontier.com.